Today, we are going to look at a BodyViz brain builder about the female reproductive system and ovarian cancer. The female reproductive system is composed of the external genitalia and the internal pelvic structures. The external genitalia includes the labia majora, the labia minora, and the clitoris. The internal pelvic structures are the ovaries, which we will learn more about later on, the uterine, or also termed the fallopian tubes, the uterus, and the vagina. The female reproductive system has many functions, which include producing ovagametes, providing a site for fertilization, supporting the implantation of the fertilized gamete, providing nourishment to support the developing fetus, delivering of a human fetus, producing and releasing female sex hormones, and nourishing the baby following delivery. The ovaries are the female gonads and function to produce ova and female hormones estrogen and progesterone. These hormones influence the cyclic production and maturation of the ova, influence the development and maintenance of the secondary female reproductive organs, establish the microscopic requirements for implantation of the ova within the uterus, and maintain the uterine characteristics required for retention of the embryo and fetus within the uterine cavity until expulsion at birth. Each ovary, which is approximately 2 centimeters wide, 3 centimeters long, and 1 centimeter thick, lies between the uterus and the lateral pelvic walls. However, the position of the ovaries may vary slightly within the pelvic cavity, depending on the individual's body position. Ovarian cancer is the result of abnormal and uncontrollable cellular growth within one or both of the ovaries. There are 3 types of ovarian tumors: stromal cell tumors, epithelial cell tumors, and germ cell tumors. Next, we will look at the symptoms, causes, and treatments for ovarian cancer, and finally give a patient example. In the early stages of development, most individuals exhibit no signs or symptoms of the disease. Or if they do, the signs and symptoms are often blamed on other common conditions. Some of the more common symptoms associated with ovarian cancer are indigestion, constipation, acid reflux, bloating, pelvic pain, abnormal vaginal bleeding, and/or nausea. The cause of ovarian cancer is unknown, although it is believed to be the result of one or more genetic mutations within cells in or near the ovaries. Treatment of ovarian cancer usually involves both surgery and chemotherapy. However, sometimes other treatment options are used as well, which include targeted drug treatments focused on specific weaknesses present within cancer. Hormone therapy uses drugs to block the effects of the hormone estrogen to the ovarian cancer cells. Some ovarian cancer cells use estrogen to help them grow, so blocking the estrogen may help control the cancer. And immunotherapy uses the immune system to help fight cancer. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 27. Gender, female. Chief complaints, erratic menstrual cycles for the past 3+ months. Bloating, pelvic pain, urgency with urination, and difficulty eating. You invite the patient into your office for an examination. During the physical, your patient explains that she and her husband have stopped having sex due to pain she experiences during intercourse. Additionally, she has been experiencing fatigue, an upset stomach, and back pain. You continue with a complete gynecological exam, including a pelvic sonogram. From the sonogram, you can tell your patient's ovaries are abnormally large, and she needs to undergo further tests. You schedule a CT scan, and from the CT, you can see cancer present in her right ovary. Your diagnosis is stage 1B ovarian cancer. You sit down with your patient and her husband to discuss treatment options. Your top recommendation is a combination of both surgery to remove the ovary and chemotherapy. This is a classic example of ovarian cancer. Want to see more 3D anatomy? Check out BodyViz 3D Dissection Software, an online learning portal with active learning modules, automatic grading, and real patient anatomy. Go to bodyviz.com to learn more.